Welcome to Pharmacist Michael's Happy Healthy Living. We're kicking off a little series about depression, and in this first video, we're going to talk about what depression is, the signs and symptoms, and what could make you more likely to experience it. We'll keep it simple and straightforward so you can get a good grasp of this condition and know how to help someone who might be dealing with it. First, let's clarify what depression is. Depression isn't just feeling sad or having a bad day. It's a genuine medical condition that affects how you think, feel, and act. It's like a cloud that hangs over your life, making everything seem gray. Depression isn't the same as your everyday ups and downs. It's a more profound and long-lasting kind of sadness that can affect many parts of your life, like your relationships with family, friends, and how you manage at school or work. Depression can happen to anyone. If you've been through tough times like abuse or big losses, you might be at a higher risk. Depression isn't rare. In fact, about 3.8% of the population experiences it. That's 5% of adults. And when people get older, it's still a concern, with about 5.7% of adults over 60 experiencing depression. Globally, a whopping 280 million people grapple with depression. Sadly, depression hits women more than men, with women being about 50% more likely to face it. To make matters worse, more than 10% of pregnant women and new moms also deal with depression. And here's the heavy part. Over 700,000 people lose their lives to suicide every year. It's the fourth most common cause of death in young people aged 15 to 29. Even though there are proven treatments for mental health conditions, it's shocking that more than 75% of folks in lower and middle income countries don't get the help they need. There are many barriers, like not enough support for mental health, not enough trained healthcare providers, and the shame people sometimes feel about mental health in general. Feeling down for most of the day, nearly every day, is a hallmark of depression. It's not just occasional sadness, it's a constant state of emotional pain. People with depression often lose interest in activities they used to enjoy, whether it's hobbies, socializing, or even spending time with loved ones. An unshakable tiredness that doesn't improve with rest is a common symptom. You might feel physically and mentally drained. Depression can lead to changes in sleep patterns. You may struggle with insomnia and find it difficult to get a good night's rest, or, on the flip side, sleep excessively. You might lose your appetite and experience weight loss, or find yourself eating more and gaining weight. Individuals with depression often have negative thoughts about themselves, feeling like a burden, or that they're to blame for everything. It's tough to focus on tasks or make decisions when you're depressed. You might also have memory problems. Depression can manifest physically with unexplained headaches, stomach aches, or other discomforts. You might become easily agitated, even over small things when you're dealing with depression. The most serious symptom is having thoughts of death or suicide. If you or someone you know is experiencing this, seek help immediately. Call the suicide hotline at 988. When someone has depression, they might not take good care of themselves, like forgetting to shower or brushing their teeth. They could also gain or lose weight without trying, and they might not want to be around people as much. The tricky part is that there aren't any special tests like blood work or scans that can say, yep, you definitely have depression. Instead, Doctors and experts use other methods to figure it out. What are the risk factors and possible causes of depression? It's like a puzzle, and one of the pieces is genetics. If people in your family have had depression, you're more likely to get it too. Now here are some other puzzle pieces. If you're a woman, you might be at higher risk, as mentioned earlier. And if you're in your middle years, Native American, or don't have much money, your chances of getting depression go up. Also, if you don't have a job, or you've lost a loved one or separated from someone, your risk is higher too. Some other puzzle pieces include having other mental health issues, physical disabilities, or ongoing health problems. And if you've been through really tough times like a lot of stress, that's another piece of the puzzle that makes depression more likely. As a pharmacist, it's important for me to mention that some medications can actually make you feel down. Let's keep it simple and go through a few common ones. First off, if you're drinking alcohol and feeling depressed, it's crucial to get some help. Now, regarding certain medications, ones like acyclovir, benzodiazepines, beta blockers, opiates, corticosteroids, barbiturates, calcium channel blockers, and drugs for epilepsy could potentially play a role in making you feel low. This isn't an exhaustive list, so if you suspect your medications might be part of the problem, it's a good idea to have a chat with your pharmacist. They can help you figure out if your meds are connected to your feelings of depression. If you or someone you know is showing signs and symptoms of depression, it's crucial to seek help. Depression is treatable, and no one has to face it alone. You can reach out to a mental health professional, a therapist, or a trusted friend or family member. Be sure to look for other videos in this depression series. I will place them in a playlist so they can be easily located. Remember, depression is a real and treatable condition. It's important to recognize the signs and symptoms so you can take the first step towards getting the help and support you need. You're not alone in this journey. If you found this video informative, please hit that like button and consider subscribing for more content on mental health and well-being. Thanks for watching, and remember, there's always hope and help available. My name is Pharmacist Michael. Be happy and be healthy.